Thank you so much for listening to my presentation today. I'm Ayşe Guler, and I'm a postdoctoral scholar at the University of Kentucky Center for Research on Violence Against Women. First of all, I would like to thank the Society of Postdoctoral Scholars community to provide this opportunity to present my research. My research study is entitled Understanding of Risk Factors in the Process of Seeking Help for IPV. Intimate partner violence is a preventable public health issue disproportionately damages the health of millions of women around the world. Intimate partner violence, or IPV, refers to behavior by an intimate partner or ex-partner that causes physical, sexual, or psychological harm, including physical aggression, sexual coercion, psychological abuse, and controlling behaviors. How big is the problem? Why it is so important? Because IPV starts early and continues throughout the lifespan. IPV is very common. As you can see the statistic, globally, nearly 1 in 3 women are exposed to at least either sexual and physical IPV in their lifetime. In the United States, about 1 in 4 women are exposed to sexual and physical IPV or stalking by an intimate partner in their lifetime. This map demonstrates the high prevalence of IPV among women across different countries. IPV has many short-term and long-term effects of women's health. These include a range of conditions affecting the heart, digestive, reproduction, muscle and bones, and nervous system. And many of these conditions are chronic conditions. Some of the well-reported IPV-related adverse health outcomes include, but are not limited to, traumatic brain injury, multiple bone fractures, physical and mental impairments, depression, post-traumatic stress disorder, anxiety, and substance abuse disorders. Women not only suffer from IPV-related health outcomes, they also suffer from IPV-related economic costs. The lifetime economic costs associated with utilization of medical services for IPV-related injuries, lost productivity from paid work, criminal justice, and other costs was $3.6 trillion in the US. The estimated IPV lifetime economic cost was more than $100,000 for women and $23,000 for men. Studies show that individual, relational, community, and societal level risk factors are associated with women's exposure to IPV, and these factors also related to women's help-seeking decisions for IPV from formal and informal resources. Help-seeking process for IPV is complex, nonlinear, and influenced by multiple levels of factors. Women's decision to seek help for IPV associated with women's recognition and definition of IPV, decision to seek help, and the selection of support from formal and informal resources that influenced by individual, interpersonal, and sociocultural factors. The purpose of this study was to understand the influences of risk factors in the process of seeking help for IPV from formal and informal resources among women who have experienced IPV. In this study, seeking help for IPV from formal resources refers to criminal justice system, social service agency, healthcare providers, domestic violence services, and public or community resources. Seeking help for IPV from informal resources represent family, friends, neighbors, and coworkers. Here is a study procedural diagram to provide an overview of the study process. As an explanatory sequential mixed method study design, first the quantitative phase was implemented, followed by the qualitative phase to explain and extend quantitative results. The purpose of quantitative phase was to explore the associations as well as interconnections of potential risk factors on women's exposure to IPV. The purpose of qualitative phase was to understand how women who have experienced IPV describe the influences of these potential risk factors in the help-seeking process. When both data sets were combined, the integrated results demonstrate the underlying or understudied as well as barriers that influence women's help-seeking process for IPV. Some results of quantitative phase show that financial, housing, transportation, and childcare issues, as well as experiences of health issues, living with the abuser, level of support from informal resources, issues of access to healthcare services, found important risk factors that are associated with women's exposure to different forms of IPV. There were four major themes were emerged from the qualitative phase that the women described that these are important risk factors that influence women's help-seeking process for IPV from formal and informal resources, such as support from formal resources, support from informal resources, individual barriers, and turning points. So I selected the following codes to present the underlying risk factors that influence women's help-seeking process. One of the major formal help-seeking barriers was women's negative experiences with formal resources. Nearly all women who sought help for IPV from the police or criminal justice system stated that they were unable to protect them from the abuser or future violence attacks by the abuser. Women's decision to seek help for IPV from healthcare providers associated with different individual and structural factors, such as ineffectiveness of disclosing IPV, embarrassment and shame, fear of abuser, unable to access healthcare providers, and negative experiences with healthcare providers. Many women who sought help for IPV-related injuries noted that either healthcare providers never asked questions related to IPV, or healthcare providers never ask IPV-related questions where women would stay in a private and safe room without their abusers. Women also described the importance of receiving family support in the help-seeking process. Women shared several individual barriers for seeking help, such as sociocultural norms supported by patriarchal practices, lack of knowledge about IPV, and fear of abuser. Many women mentioned that if they would be aware of red flags in the abusive relationship or the nature of IPV, they would seek help earlier. Nearly all women share that their abuser would engage in homicide if they will seek help from formal resources. I created this figure to demonstrate the integrative findings of this study that are risk factors influencing women's help-seeking process. Help-seeking process for IPV, in the middle circle, you would see that is nonlinear and influenced by individual, interpersonal, sociocultural, and structural factors. As you will see that there is a complex interplay of multiple level factors in the help-seeking process. And many of these factors overlap and are interconnected with different forms of IPV exposure. The major point I wanted to underline is that many of these factors are modifiable risk factors. Prevention strategies should address the complexity of help-seeking process for IPV. More specifically, focusing on structural barriers such as lack of or limited support from formal resources, negative experiences with formal resources such as criminal justice system, healthcare providers, or domestic violence services, and limited financial and child care support from federal and state government, lack of availability and accessibility of community and public resources for women. To remember that IPV is a preventable public health issue and violation of women's rights. Women's decision to seek help for IPV tend to be multi-phased and may, depending on a variety of IPV experiences, effectiveness of current IPV coping strategies, fear of abuser, stigma on IPV victimization, presence of IPV-related injuries, or as well as mental health issues, and the belief of how effective these resources if they would seek help for IPV. To prevent IPV, we need to raise public awareness about IPV, risk factors for women's exposure to IPV, as well as detrimental health outcomes of IPV on women's and children's health. And thank you.